The apparatus, materials and reagents not to interfere with the test systems. Chemical reagents and solutions should be labeled to indicate the identity, expiry and specific storage instructions. Uh, we should classify these things based on the utility. For example, raw materials, the reagents and the solution should be whatever you are using the in the assay. The chemicals, the expiry of the chemicals must be clearly indicated along with the labels whether it is hazardous, toxic or lethal. The reagents are several reagents are used and they can be liquid or in any forms. They should be mention their lethality, toxic and the solution or whatever you are using. And apart from it, there is special guidelines. For example, the chemicals are in touch with the humans or any animals. So they might be cause of the toxicity or there can be some burn. If somebody is exposed to the chemicals, so what should be the preventing guidelines? How we can prevent the further damage? So there is a guidelines. There should be SOPs for the managing the harm. Identity clearly mention the identity, molecular formula, expiry and specific storage conditions. Specific storage conditions are different for each chemical. Some are required room temperature, some are required refrigerator, some are required -80. Some biological samples are required any other storage conditions. Some are stored during the nitrogen cylinders. So, special conditions are required. For example, the cell lines. Cell lines are required are different storage under the nitrogen cylinders. So, what should be the temperature plus minus and a regular supply of the CO2 is required. So, we need to identify the special conditions for the each chemicals for biologicals and blood samples. For example, today we are performing any chemical assay on the blood samples. We cannot place the blood on a room temperature for conducting several studies. So, we should place the blood samples into refrigerator or a temperature as recommended by the protocols. The test system, physical and the chemical test systems, appropriate design and adequate capacity of apparatus used for the generation of the data. These are the major systems. We are performing a test for what? So, first is the appropriate design, selection of the design. If we are performing the anti-cancer activity of a new molecule, let us take an example AB, a molecule is AB. The AB molecule we are performing anti-cancer activity. So, we should check the animal model, we should check the how we can develop the cancer in those animals models. Either it could be a chemical induced model or ex vivo models or cell line induced model. What should be the models and what is the percentage of percentage of happening the tumor in that animals models. So, selection of the animals, whether it is a normal mouse, rat or special like genetically modified knockout C50C, BALB-C, which strain will be used for conducting the test of a drug. So, it should be very clearly mentioned. And the agent, for example, DMBA. If we are performing the anti-cancer activity using the DMBA, so we should know about the concentration of the DMBA and the solubility of the DMBA, how to take care of the DMBA as it is causing the cancer and it is also causing to the humans, causing the cancer to the humans. So, we should be careful about while dealing with the DMBA. DMBA is dimethyl benzanthracene. It is a chemical used for inducing the cancer in animals. So, this should be the practice for clearly using the carcinogenic chemicals. Integrity of physical and chemical test systems. The test systems, biological test system, proper conditions for storage, housing, handling and care. Isolation of newly received animals and plant test system. If we are conducting a study on the animals and today we received the animals, first is the checking the animals, health of the animals including the segregations of the genders if we receive the animals and they did not segregate, they did not separate the gender male and female, so what will be happen? There is a breeding system and the whole test or a whole study plan will be corrupted, will be manipulated. For that purpose, we need to check the health and the pregnancy of each animals, and there is separate sex determinations and sex recognition of the animals while receiving the animals. After receiving the animals, they should be placed untouched, and they should give the proper diet at night and daytime, and apart from the water. We should maintain a good health of the animals. Humanly restrictions are the inappropriate systems. At the end of the projects, at the end of the practical, we need to discard some animals. So what should be the approach? How we can humanly distract these animals? How we can use, and we can use the 3R principle of the system: the replacement, reuse, and refinement. We can use these animals for learning purpose. We can use these animals for other purpose, for other models if they can be used. And we can reduce the number of the control animals, and we can retract some data from these animals. Record of source, date of arrival, and arrival condition of the test system. The date of arrival. Record of source. I am purchasing a chemical from Z company. To complete detail of the company, complete details of the date of arrivals in the test center, and the arrival condition of the test samples. So we should place a different labels like date of arrival. After arrival, somebody perform a test, to a label, different label, red label, yellow labels, alag labels we can use for the recognitions, the date of arrivals and arrival condition of the test system. The organoleptic properties can be traced, the structures of the packet can be performed, or any special conditions can be traced by the labels. Acclimatizations of the biological system to the test environment. If we procure some animals from different zone, so we should perform the acclimatizations of the animals. Proper identification of test systems in their housing or container or when removed. Cleaning and sanitization of housing or containers. Let's take an example of the Stanley or biotest. Biotest are performing the chemical assay of lotions and creams, but what they are doing, they are not cleaning the animals regularly, and the housing where the animals are placed, they have a 3 to 4 inches of water. It means they are causing the contaminations to each other. There is a cross contamination, and there is no further declassification of the group 1, group 2, group 3, test animals, standard, reference. There is no declassification of the animals. That is the violation of the protocols. The proper identification of test system is required. Cleaning and sanitization of housing or containers, a regular changing of the beds of the animals, a regular visit of the animals in house and by the outside to manage the control and quality of the animal house. Pest control agents to be documented. In animal house, it should be regularly done and checked. In all over the area, it should be pest control. It could be termite or any insects can be found, mosquitoes, so they can contaminate the study and they can create some discrepancies in the study. So there is a regular and periodically pest control system must be implemented. Avoid the interference from the past usage of the pesticides. If some chemicals are used in 2025, though these should not be used in 2018, depending on the usage of the chemicals, the repetition and avoidance of the interference from the past usage of the pesticides is essential for performing such studies. Test and reference items. Now, our study is based on anti-cancer. So, for anti-cancer, we need some standards. So, purchase of the reference standard items or the standard molecules. This must be purchased from a good company, from a reliable source, and they should provide the sampling record for the date of the receipt, expiry date, quantities received and used in the studies. These all should be mentioned in the protocols. Handling, sampling and storage procedures to ensure the homogeneity and stability and avoid the contamination of the mix-up. Reference should be take care of with significant care. Identification information on the storage containers. This is the special guidelines for the reference items or standard molecules. The characterizations. The identification of each molecules and reference item. We should provide some code for a test. For example, AB molecule. AB is a new drug, but what we did, we had given a code of we had given a code AB. So everybody will be aware the AB until it is disclose the activity. The case number of the reference. Reference is purchased from a standard company, so they must have the case number and name. Identification of each batch of the test. We are performing a repeated toxicological study in day 1, day 2, chemical high dose, low dose. So we should have a clear identification of each batch. Okay, we use test molecule of group 1, test molecule of group 2, test molecule of test 3, high dose, low dose, medium dose. So we should be very clearly identify each batch and carefully the identification of the reference items, batch number, purity, composition and the concentration. We use our molecules and perform some tablets. So there is a batch number, and when our batch number is prepared, definitely this is performed using some purity data. So there is a purity data 98%, 105%, how much in our test compound is pure. Compositions, the tablet is manufactured with the tulsi, that is eugenol, but eugenol is also mixed with certain ingredients. Ingredients means additives. So what is the compositions of additives, binders, what we are using and in what compositions we are using. There is a clear recognition in the disclosure ki how much concentration we are using. Cooperation between the sponsor and the test facility. That whoever is the test facility center who is performing the test facility, there is a cooperation between the sponsor and the test facility. Verification of the identity of the test items. Known stability of the test and the reference items. Stability of the test item in its vehicle container. Now, you might have noticed in your house that some are amber color bottles, some are in transparent bottles. Why it is so? Because certain items are degrade in light container or the transparent bottles. They are by the effect of light or sunlight, the chemicals is degraded. To avoid that decompositions or color change, we use amber color bottles. The stability of the test item in its vehicle container must be ensured. We should use amber color bottles. We should be placed under dark. We should be used under light or not. So it should be clear and mentioned, and the container should be easily reusable. Experiment to determine the stability in the tank mixers used in the field studies. Samples of analytical purposes for each batch. Now we are performing, we develop the tablets. So what are the analytical methods we use? Pre-formulation and the post-formulations method should be elaborately written and documented and can be reproduced. Now, standard operating procedures. As we discussed already, what are the standard operating procedures in previous lectures? The approved SOPs to ensure the quality and integrity of the laboratory data. These are the special documents that require. For example, today I am performing a study on the CNS activity. So we should start with the CNS activity. What are the inducing agents? What are the animals models available for conducting the CNS activity? So there is a number of animals are required for conducting the CNS activity or muscles relaxant activity, like the SOP of the rotor-rod apparatus. What is the SOP of the rotor-rod apparatus? Rotor-rod apparatus के लिए हमें क्या रोटेशन चाहिए, कितनी रोटेशन पर मिनट चाहिए, कितने एनिमल चाहिए, कितनी डोज चाहिए. This is documented, and my junior or my expert will guide me, or we can ensure the reproducibility and reproducibility for conducting the data. So, this for that purpose we need the standard operating procedures. Without animal or with animals, we can perform the machines. This should be a same thing. Immediately available current SOPs relevant to the activities being performed. Up there is a change. For example, the instrument is made in 2010, but there is a updation in the instrument or technology in 2015 or 2020. So, there is a different version. So, there is a continuous upgradation of the SOPs. What is let us take an example of mobile phones. In 2005 we have a basic phones, in 2010 we have a smartphones, in 2015 we have Android phones. Now further the phone technology is changing. So, how we can use, we cannot use the same techniques to the basic phones that we are using in Android phones. In the similar way the machines are changing, so we use updating, we should keep updating our standard operating procedures as per the technology, as per the instrument. Now, as we are updating, so it is ensured that we should adhere with the guidelines, and we should acknowledge these changes to the study director and others personnel involved in the study. SOPs for test and the reference items, receipt, identification, labeling, handling, sampling, these are the common things they must have maintained the SOPs. Now, all these are why we are doing this thing. The important thing is recording everything. When we are in, when we are out, which chemicals, when generated, which machines, why are using, which biological samples, CBC, TNF alpha, TGF beta, what kind of test we are doing. We are recording each and everything. For a liver disorders, we need some LFT profile liver testing. For a liver testing, we need SGOT, SGPT, but for kidney we required KFT, kidney function test, creatinine, uric acid. So, these are the difference in the testing patterns. So, this is required for keeping, reporting and storage and a retrieval for the data. Coding systems, we can code our animals, we can code our data for ease and for the purpose of the statistical analysis. Dates. Dates are important for conducting a study. Approval dates of the study plan, when first IAC is conducted, the animal ethics committee conducted, and number of animals is approved. So, we must be approval dates of the study plan. Estimated starting, we took the approval in 2025. So, when we are starting in which month, in July, in August, we have to mention the exactly date and month when we are going to start. July is a month, the rainy season is coming, but we are starting our projects in December. December is a winter season, so we need to maintain the exactly month and date when we are starting our projects. And after starting, there is a completion dates. Our projects can be 3 months, 4 months, 6 months. As a with the passage of time, there is a change in the weather. It should be, which should be considered the change in the environment for the study. Reference to test methods and records. Now, the role of regulatory authorities become important by using these 10 principles of GLP. Decision on approval or rejections of a chemical or any product is based on the information given in these GLP principles. Final report is the most important end product in the GLP, and it is reproducible and traceable. That is why the regulatory authorities are required the test reports as per the GLP. GLP scope. The GLP scope is very important for conducting the non-clinical safety testing of the test item contained in pharmaceutical products. pesticides products, cosmetic products, veterinary drugs, food and feed additives, industrial chemicals. Now let's take an example of the cosmetic. Everywhere around the world, people are keenly using the cosmetic, using mascara, skin whitening creams, and lipstick, but they contain heavy metals. And what should be the limits for the heavy metals? It should be, it can be arsenic, mercury, lead. So what should be the permissible limit for the cosmetic? And in certain regions, children are also using the cosmetic products. If the children or pregnant women are using they can cause a nephrotoxicity and the neurotoxicity due to the cumulative depositions of heavy metals. If this is the case, so what would be the guidelines? And there is a harmonizations of required for the permissible limit of the heavy metals. What should be the permissible limit? It should be like in India, in Europe, in USFDA, in other countries, South Asian countries, there is a harmonizations like less than 1 uh, parts per million, 1 ppm. So different range can be decided by conducting a test on the on the heavy metals, and there is a uniformity of the range of the heavy metals in cosmetic products. Veterinary drugs, some are used in dogs, some are used in cats, and even some antibiotics, those who are applicable in humans, also prescribed to the dogs and the cats. So what should be the ideal dose for the animals? It should be clearly mentioned. Food and feed additives. So, in the morning we are using some food products, using the packet products. So what are the preservatives and the range of the preservatives used? Industrial chemicals, the paint, using the tanning industry. So what are the whenever we are using the chemicals, industrial chemicals, so the carcinogenic levels and the hazardous level should be checked. GLP scope, the test item can be synthetic chemicals, natural or the biological or living organisms. Whenever we are using, the testing can be done. The synthetic example, we have a paint. Natural or the synthetic examples can be a paracetamol, can be ciprofloxacin. They are the synthetic chemicals. They are used. So we can perform the test of these drugs. These are synthetic chemicals. Now the natural or the biological origins. In day to day life, we are using some syrup, some herbal drugs. They are naturals. We are using these molecules, so we can perform some chemical test or the toxical studies on the natural or biological. Living organisms, we can perform the certain test on the living organisms. And biological origin, like milk, we are using in milk in day to day life, and mostly a lot of milk are contaminated with adulterated or urea. So we can focus on the strict guidelines for the adulterations using the GLP. The GLP non-clinical studies. The toxicity GLP is applicable to various studies used in the non-clinical studies, particularly for the toxicity studies, mutagenicities, pharmacokinetic and metabolic studies, physicochemical studies, analytical and clinical chemistry studies, environmental toxicity studies on aquatic and terrestrial organisms, studies on behavior in water, soil and air, bioaccumulation, etc. For this, we can use a term water pollution, soil pollution and air pollutions conducted in the laboratory, greenhouse and fields. We can perform these non-clinical studies within the laboratory, greenhouses and other fields, so that we can protect our environment. With this, these are the major objectives of the GLP or the toxicity of studies: to identify any toxic substance prior to the clinical use, qualitative and quantitative assessment of drug use. Now, what do you mean by the qualitative and the quantitative? A drug which is used for reducing the fever at 300 mg, 300 mg, but it can be toxic at other dose, 2 gram. If someone take a drug of 2 gram, can be lethal to us. 2 milligram alprazolam is used for hepatic and sedative actions, but when the dose is exceeding 20 mg, it can be lethal, it can be toxic to us. So, qualitative and the quantitative, it must be and be clearly mentioned. Mostly used to examine, and these toxicity studies are used to examine the specific adverse event or specific endpoints such as a cancer, cardiotoxicity, skin and eye irritations. Different types of dose identification can be done. First is LD50, lethal dose 50, MTD, maximum tolerated dose, ED50, effective dose, and MLD, median lethal dose. These are the some objectives of the toxicity studies. We need to focus and how we can use these GLP principle for conducting the studies to non-clinical studies. With this, I would like to say thank you.